My name is Gasia, Mikaelian. I'm coming to you from KTVU Fox 2 News in the San Francisco Bay Area. Today we're talking about the impact the COVID-19 pandemic has had on our overall health, but also our eye health more specifically. Let's welcome to the conversation Dr. Daniel Laroche, President of Advanced Eye Care of New York. Thanks for being with me, Doctor.
Thank you. Thank you for having me.
I know a lot of people were reluctant to go to any doctor unless it was a dire emergency. It feels like that's loosening up some. What do you see from where you are?
Yes, in New York, when we had the peak of the pandemic, it was a little bit dangerous to go to the hospital because of the high density of patients that were COVID positive. Now, everybody's masking, hand sanitizing, social distancing. Our numbers have come down dramatically to less than 1%. So now everybody's doing that. It's safer to go out to the hospitals now. Keep your doctor's appointment visits, get your eyes checked, get your health checked, and people can circulate. So we're almost basically back to normal. Recently, we just opened our restaurants, but the key is getting those numbers down to less than 1%.
The setup you have behind you in your office is very similar to what my doctor here in the Bay Area has, Dr. Yee. I got a notice from her optometry office a few months ago saying we're open again with all the list of things they're doing differently. But it took me a couple months before I felt okay making an appointment. I'll be honest, I didn't want to be the first one back. There were a lot of changes when I went to her office, and I imagine the same is there at your office as well.
Absolutely. Patients that are 65 and older, we try to really screen them with a telehealth consultation to see if they really need to come in because they're high risk, or if they have certain pre-existing comorbidities, like if they have a diagnosis of cancer or immune weakness. Patients that are a little bit younger than that, when they come in, we have a questionnaire. Have they been exposed to COVID? Do they have any fever, any symptoms of cough? We also take their temperatures. So everybody gets screened. Also, within our office, we have plexiglass barriers throughout. Everybody has to wear a mask. We have chairs 6 feet apart, social distancing. We have filters in each one of our rooms to filters the air as well. So we've been open for a few months now, and it's been very safe. So I do encourage people to get back out to the doctor's office, make sure that the doctors have implemented these changes, which majority of them have, and make sure you take care of your health because there are a lot of things we could do to help prevent issues in terms of eye care, getting checked for glaucoma, cataracts, diabetic retinopathy, getting your blood pressure checked, getting your sugar checked, making sure your health is healthy. Because a lot of people during the pandemic that was staying at home, they weren't getting their regular checkups, and some people were having heart attacks, losing their vision from glaucoma, losing their vision from diabetic retinopathy. And so we want to help prevent that and catch that up. We had a backlog. We were doing a lot of surgeries and a lot of care that we had a backlog that we had to catch up on. We're in the process of catching up on that.
For someone who may not be very in tune with their own eye health, I think a lot of people say, hey, look, I can see the computer screen. I can see the movie that's on TV across the living room. I'm okay. What are some of the signs that we should be looking for and listening to when it comes to we might not be okay?
Well, if you have blurred vision, that's one sign. But in some diseases like glaucoma, that's an insidious thief of sight. You can see 20/20 for distance and for reading and still have glaucoma because it takes your peripheral vision away first. And then by the time you notice the central vision being gone, you've lost 95% of your vision. So anyone over the age of 40, it's very important to get your eyes checked and make sure you get your eye pressure checked. Like when you touch the eye has a pressure. Normal eye pressure is 15. People with glaucoma usually have a pressure of about 18 or higher, and you won't feel that. So that's very important to get that checked once a year. Check it, make sure you have the proper vision, you're seeing okay for the computer. Everybody's doing Zoom nowadays, and that could be a source of stress and headaches if you don't have the proper prescription. So you want to get that checked out. If you have diabetes, you want to make sure you get your retinal examination checked because you could have underlying retinal disease and not know it till very late. And by the time you lose the vision, you can't get it back. So it's very important to get an annual eye examination, get checked out.
Yeah, I have to admit, I went about a year and a half because I typically get mine in March. But then, of course, this March is when things started shutting down. So I put it off. And after I walked out of Dr. Yee's office, I felt great because I felt like I had a clean slate. There were no problems that she detected. And she actually found that my eyes were a little bit healthier than when I'd seen her a year and a half ago because I'm not wearing contacts. I'm clearly working from home. I'm not in the studio wearing contacts to read the teleprompter. So my corneas, I think, were chapped last time she checked me, but she goes, you know what, your corneas look great. And I said, okay, one small benefit of the pandemic because I'm not wearing my contacts because I can see my monitor clearly in front of me.
That's great. And we have some new breakthrough technology. One of the leading causes of blindness in the African American and Afro-Latino community is glaucoma. And with early cataract surgery and trabecular bypass surgery that takes about 15, 20 minutes, we can help prevent glaucoma and really lower the pressures to normal to prevent blindness from glaucoma. So with early detection, early treatment, we can help really prevent blindness.
Let's talk a little bit more about what you just hit on there. The lack of care for many people in what are typically called minority communities, African Americans, members of the Latino community. We're here in California. There are many people who simply don't have the access to healthcare that they should. And I imagine you would say that this pandemic has only exacerbated that.
Absolutely. Before the pandemic, we knew there were healthcare disparities. If you looked at PubMed.gov, if you did a research search on healthcare disparities, 50,000 articles would come up. So we knew it existed, but the pandemic has shined a light on it. And solutions to this, including one, making everyone have universal healthcare access. Everyone having good health insurance so they can access a doctor. That's one. We have millions of people that are uninsured or underinsured and can't get to the doctor. So that's one. But that alone is not enough. Two, we have to really remove some of the structural barriers, structural plantation capitalism barriers that affect housing, education, criminal justice, healthcare, workforce, because there's a huge wealth disparity gap. The average white household income is about 171,000, and the average black household income is about 17,000. And so that huge wealth gap contributes to healthcare disparities. And then three, in my profession, I'm an eye surgeon. There are 41 million blacks in the United States. There are only 400 black eye surgeons in the United States. And unfortunately, we still have a lot of segregation in terms of how people live throughout America. So blacks, Afro-Latinos don't have as much access to minority specialists in their communities. So that lack of access, they can't access people to get their eyes checked regularly and checked early enough and screen for high blood pressure, for diabetes. So we have to diversify the medical workforce. So those are three big things that need to be addressed and need to be done as well.
When it comes to that last point that you made, a lot of people who've never been in the position of never being able to receive care from someone who looks like them might say, what's the big deal? A doctor is a doctor. But it can speak to very long-standing beliefs from someone who says, I can't trust a doctor I feel I have nothing in common with.
Well, there's two things. One, a recent study came out and showed that when black babies at birth were cared for by a white doctor versus a black doctor, there was a 3-time difference in terms of the death rate, just based on race alone. Being cared for by a white doctor, 3 times greater mortality rate compared to a black doctor. We don't know exactly all the reasons behind that, but that's a stunning number in that respect. 2, we have a huge maldistribution of physicians, okay? More so in the East Coast and the West Coast, less so in the South. And a lot of that is based on race. 3, it's well known that minority physicians, black and Latino physicians are much more likely to practice in black and Latino communities. So that's going to create greater access as well. Here in New York City, we have a variety of different ethnic communities. We have Chinatown, we have Little India, Koreatown, and we have a diversity of physicians that reflect those communities, that practice in those communities. But there's very few in the black community and Afro-Latino community. So we have to change that to help give better access to care as well.
What do patients say, when it's your first meeting with the patient, what does the patient say about why he or she chose you? Does race come into that conversation?
I'm in Harlem and in Southeast Queens, and those are predominantly African-American and Afro-Latino communities. So I service those particular communities, so most of my patients have that makeup of the community. But I also uniquely have extensive experience as a glaucoma surgeon. So I'm like, a highly trained glaucoma surgeon. So I have people that come from outside communities to come see me, including Caucasian patients, because they see I'm one of the most experienced surgeons for glaucoma, and they look me up, they read about me, and they know I'm doing these new procedures, and they want me to do their surgery. So it's a wide mix in that respect. I think that, but my being in the community as well, people feel comfortable with that, accessible. They feel confident that I'm listening to them, and I'm listening to what their needs are and addressing them. I'm nearby in the area. So there are some people that just feel comfortable as well.
Yeah. It reminds me in a very small way of an experience I had at my own news station. In our control room, most of the people who work on the production side generally are male. We have one female director. She's incredible. Her name is Melissa. It just happened that the day my two little boys visited mommy at work, this is pre-pandemic, I said, let's go in the control room because I wanted them to meet Melissa. She would be the first director they'd ever seen. And I wanted them to know that, guess what? Women can be directors too. So just that first little, planting of the seed at the very beginning, now they won't question it when they see hopefully another female in the control room. I imagine medicine is a lot like that as well.
Women have made a tremendous progress in medicine. Now the medical school classes, the women outnumber the men. And so tremendous progress has been made. Now we have to translate that progress to leadership positions in companies and eye care, equity in terms of practices and things of that nature. But women have made a tremendous amount of progress over the years, particularly Asian men and women, women in general. But unfortunately with Black men, the number over the last 20 years has been flatlined or gone down. And so we have to pay special attention for that because we have to really address the reasons for that.
Can you talk a little bit about, you talked about I've heard the term generational wealth. I know I've heard stories of, my daddy went to Harvard, and so of course I'm going to Harvard. But for someone who decides he or she wants to be a doctor early on, who maybe didn't have a daddy who went to Harvard, or maybe doesn't have grandparents who can say, I will pay for your education no matter where you'd like to go. People don't often think of that as a way to really cut down on who gets into these elite universities that many people who are just searching online for an eye doctor might look for.
Well, in terms of generational wealth, that helps. That's like an affirmative action to get into some of those schools in some ways. Families that have a lot of wealth, they make contributions to the schools, they can pay full tuition, the Harvards, the Yales. There's a certain amount of people that just get in just because of that in that respects. I went to Cornell, which is an Ivy League university. I went to NYU as well, and I was able to get some scholarship money in that respects. And both those universities were making efforts to diversify their class. Harvard is still doing that today to make an effort to diversify. I think all universities across the country should make an effort to do that, to train people that reflect the fabric of America, so that we can get leadership and reduce disparities, and that makes our country better, makes our country more productive, and you see less inequality, which hurts our country in that respects. But one of the other major things is that we have to have a better safety net. In New York, we have a minimum wage of $15 an hour. That's like a living wage, but in many parts of the country, it's as little as $7. And that's not quite a living wage. So we have to increase our minimum wage for everybody across the country to a living wage. And then also for those people that are unemployed, so they have access to food and basic housing, perhaps giving them a stipend of maybe $7 an hour, just something until they can get out of their poverty situation, until they can get a job in that respect. And that will go a long way to helping address healthcare disparities.
I know so many people have noted that the current pandemic really just exacerbates the wealth gap, because those people who are, lucky enough to have a home and have a home office and have a job that allows them to work, from the safety of their own laptop, they're still getting that paycheck. But so many people who often are female, from minority populations, they're the ones who are in the service industry. They're the ones working in hospitals. They have to go to work and expose themselves to, COVID-19 or whatever else is out there. They're also among the first to be laid off, because many industries, the restaurant industry, tourism, are taking huge hits. So, while you have some people saying, we're okay, other people are saying, my husband and I both lost our jobs. We don't know what to do. And, unemployment isn't cutting it.
Yeah, you're absolutely right. And then some of these people, we call them now essential workers, and they're essential because some of the jobs that they're doing are quite vital, but they're not paid as well. Not paid as well to the point that sometimes they need two jobs. That increases their exposure to the COVID virus. They don't have health insurance on top of that. And so that's why this pandemic has opened our eyes to that. Say, hey, okay, these essential workers, they should also have health insurance. They should also have a living wage. So they don't have to work two jobs to expose themselves twice as much. Maybe we can live on one job type of thing. So we have to really look at that. And we can't say we don't have the money, because we have trillions of dollars that were spent just like that. So we do have the money as a better safety net to make our country better. And all that money will still go back into the American economy. The stock market's at all-time highs during the pandemic with this stimulus money. So we have to relook at our society and structure to make things that can help make a positive impact on health.
I know here in California, some cities have taken up guaranteed sick days because, I explained this to my little boys because they said, oh, what happens if you're sick, but you're still at home? I said, well, I'm lucky. I have sick days I can take and I still get paid. I said, but there are people who, if they call in sick for their shift at the grocery store, they're not going to get paid for that day. And so many people, we've heard these stories again and again saying, I can't afford not to go to work. So they're putting themselves in a dangerous position and all the people they come in contact with.
Well, I agree. I mean, I think that, people should be entitled to sick days, particularly if they have a legitimate illness and they have a doctor's note, and compensation should be paid. And that's something we can look at from a legislative perspective. We could encourage employees to do that as well. And so that's something definitely can be looked at.
So finally, for people who are just having their eyes opened, if you will, to this issue of health disparities, is there a resource online that you would like to point people to if they'd like to learn a little bit more?
The National Medical Association has a lot of information on healthcare disparities. You can go to pubmed.gov, and if you want, there's health disparities in all kinds of different fields. So if there's a particular field, public health, ophthalmology, you can look up that specific field, healthcare disparities with whatever specific field, pubmed.gov. There's pubmed.gov. You'll find resources and articles that can guide you specifically to the area that you want to see. But we do need all of the government and state governments and local governments, all corporations, to chip in and look at their leadership to make sure it's diverse, to reflect the fabric of America, and to devote a certain amount of finances to invest in healthcare disparities and eliminating healthcare disparities to make our country a much better place. I mean, right now with the COVID pandemic, we have the highest number of infection, the highest number of deaths compared to other countries. I mean, look at Korea. Korea only had 400 deaths. We're near 200,000 deaths. And so there are some simple things that we can do to help make things better for our country.
Well, I know, again, you're speaking to us from New York, and boy, that city has been through it. You bore the brunt of it early on, and it's so heartening to hear that just now some more businesses are opening up. I know life is still very, very different, but any small step toward progress is certainly welcome. Thank you so much for your time today, Dr. Daniel Laroche, President of Advanced Eye Care of New York. I'll say it again, I got my eyes checked, and I'm so glad that I did. Thank you for joining us.
Thank you, it's been a pleasure.